At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live. You'll have to forgive the graggly throat a little bit, but I'm okay. It's just something got to me. I think it's an allergy of some sort. And where I got this silly thing is in Alaska. Yeah, we just got back. We were on a cruise, and there's a couple things that I've learned from that. One, I will never take an Alaskan cruise again, particularly this time of the year. It rained for 4.5 days while we were out there. And then we kind of floated around and it rained again. And so what I'm telling you is that I didn't know it was a tropical rainforest up in that area. And so that was okay. I was totally cool. Then the last day we were in Denali Park. Now, if you've ever been to Alaska, you know that it has all these amazing wild flowers that are sitting out there. And these one type of flowers that there's little like puffballs, if you will. They're white and they puff and they seed all over the place because snow is coming now, right? So they want to get into the ground. So guess what happened? I got a nose full repetitively over and over and over and over again. And so subsequently, this gravelly voice of mine has become gravelly. I feel great. It's just I have no voice. So if you, are irritated, I am sorry. But guess what? I'm irritated too. I don't know why it took place. Listen, we're going to talk about a couple of things today that has to do with people's concerns. If you look up in the internet anywhere, and you ask the question, what are the most feared health conditions that people say, oh my God, what happens if? And it starts out with number one is cancer. 84% of people responding to surveys said that they fear more than any other health problem, cancer. Understandable, right? Because we see cancer associated with pain and all kinds of infirmity and loss of function and slow deterioration. Get the second one is Alzheimer's and dementia. About 80% of the population looks at that type of thing as I'd rather not be here than have to not know who I am, what's going on, how to function. And we're going to start talking about that. We're going to not Alzheimer's, although we'll work our way into it, but we're going to talk about the inability to think, the inability to remember, the inability to, if you will, understand communication. And there's many different descriptions about that. But before we get into those feared, oh my God, what happened if that happens to me situation, I want to touch upon something because a very dear friend, a listener of the program, asked me to kind of touch on this crazy COVID thing that's out there right now. Like everybody's, saying COVID is back and it's back with a vengeance. Well, let me tell you a little bit about it, right? COVID is going to be with you forever, my friends, just like the flu. And it continues to morph and change. And it does that by survivability instincts. It doesn't want to be destroyed. Now, the thing that you have to remember is that COVID, and remember I listed the most feared situation. COVID is the 5th most feared health condition in the United States. Now, when we understand that, but we understand the hype behind it has to do with a lot of media positioning. But COVID, the extracts of it, the mutations of it are actually very easily treatable, but you have to make sure you understand it. It's not by doing Paxlovid and things of that nature. It's keeping your immunological system at a very, very high level. But let me start from the beginning. COVID will always be there. And if you're susceptible to any type of viral condition and health condition, you're going to be susceptible to this new range of variants that keep coming out. So what's a person to do? Well, first, number one, you have to realize that the United States has more chronic conditions than any other place in the world. Why is that? It's because we don't take care of ourselves biochemically, we don't take care of ourselves emotionally, and we don't take care of ourselves neurologically. So structural, chemical, emotional. So let's remember that just for a second. Your immune system is a combination of many different systems, but that's not what we're going to talk about today. So I just want to touch upon it. So when we talk about immunological function, the first thing we have to talk about is your gut, your intestinal tract, your microbiome, all those good guys that are in there that are supposed to do the job and produce your immunological responses, your neurotransmitters, all the interconnected pathways in your system. And that's why it's called the second brain, by the way. And we're going to touch a little bit about that today as we get into the program because of the dementia topic that we're going to be talking about. So understand that if your intestinal tract is working the way it's supposed to, then your chances of coming down with much of anything is going to be modified significantly. Take a look around you next time you're down any place publicly. How many overweight people do you see? You know, I would guess in our world here that about 40% of the United States population is not in an ideal weight, that they're way too big. And so subsequently, what does that do? That dramatically decreases immunological response because we're having to fight those excess stresses that become part of our day-to-day situation. Now, when we talk about dementia, when we talk about cancer, when we talk about heart disease, when we talk about strokes, we talk about COVID and other viral patterns, we're talking about this whole pattern. So we're going to get into that a little bit, but just as an antidote, make sure that, you know, when you're hungry, that you're eating alkalizing foods, you know, vegetables, those green things that nobody likes to eat, those are your friends. Make sure you're staying away from heavy grains. You're not a cow. You don't need to be putting those things in your body. Clean proteins are your friends. Nuts, seeds, things of that nature. But make sure you're getting extra amounts of vitamin D. Every one of us in the listening audience in the Washington, D.C. area are 78 to 80% of you are vitamin D insufficient, and you need to be taking it on a day-to-day basis, as well as some vitamin C, a little bit of zinc, things of that nature, even melatonin at low dosage, because we know that melatonin dramatically upregulates your immunological system against viral patterns. So we're going to leave it at that for today, but I want you to know that this is not a death knell. It's going to be there forever. It's, you know, it's sitting up there with, oh my God, you know, type of fear pattern. But we're going to talk about something that's, I think, is very critical, and it's going to lead into a program that we're going to do at the Roselle Center for Healing in Fairfax on October the 9th. And that'll come up in about 4 weeks from now. And what are we talking about? We're talking about dementia. We're talking about trauma and concussions and all the other things. But I want to talk about the biochemical pieces. I want to talk about trauma-induced conditions as it has to do with this ugly situation. Think about this. What happens, you know, as time goes on and you forget how to do simple tasks, or you begin to lose coordinated patterns that used to be so simple for you? Is that a result of aging or as a result of something else? Well, I'm here to tell you that we're all going to get older, but there are some people that are extraordinarily capable and others that just seem to lose capacity. Memory takes us a little longer. We don't assimilate information the way we used to. And we start seeing tags like traumatic brain injury. We start seeing tags like concussion mimic dementia. We start seeing tags, you know, that describe this frightening situation, this neuropathology, this clinical brain deterioration that is happening to way too many people. There was an article that was published in the National Center for Biotechnological Information, and one of my favorite places to read. And it was, the author was Peter Herman. And this goes back about 2 years ago, in 2022. And the article was simply rapidly progressive dementia. And it was talking about things that were triggering it and the diagnosis and the management and so forth. It's an article that's easy to read. And I would encourage you to jump into PubMed, try to find it. And they go in, they talk about rapidly progressive dementia, common or commonly used, if you will, to describe cognitive problems and fast progression, deterioration of mental capacity. Now, let's kind of break it down just a little bit before we get into some of the things I want you to walk away with from today. If you forget how to do something mechanically, we know that is a lower brainstem problem, a cerebellar problem, very much like a Parkinsonian type of pattern where you see the tremors and so forth. Well, it goes beyond that. It goes to losing the dance step. You know how to do the waltz, but for some reason now you can't do the waltz like you used to do the waltz. And it's the firing between the lower part of that brainstem and the transmission down the stream to the rest of the neuromuscular connections. An interesting video, if you want to look at it, it's 2 minutes, and it's called Frontal Temporal Dementia. I would encourage you to read or look at that. And it came out of, I think you can get it on YouTube, and it talks about neuroscientifically challenged situations and the things that they understand and the things that they don't understand. But let's jump into this just a little bit, and let's talk about this craziness. But I want to do it from a point of impact injury, and then just kind of mentioning that. And then, so many different diseases, if you will, but we're going to leave it to injuries and that are either direct to the brain or they're subtle. They're a whipping type of action, very much like a car accident or a fall, or, we know that shaking a child when they're an infant like that can cause neurocognitive damage long term, but also neuromechanical damage early on. So when we're shaken, if you will, without any kind of protection. So what are the things that may cause that to be even worse? I'm going to give you something very simple that you may not have thought about. Remember, the cerebral spinal fluid is a buffering mechanism as well as a couple other things. It buffers the brain and the spinal cord, particularly the brain, from ricocheting off the walls of the skull. So if you get hit and the spinal fluid is low level, that impact, that ricochet off the walls of the skull is going to be much more significant and potentially damaging than it would otherwise. So what's going to cause that? Well, we know that it's produced by fluid, and we know that it's a fluid itself. So what is it? Well, it's called dehydration. If you're a drinker, you dehydrate your system. If you're getting high acid foods, you will dehydrate your system and exchange it with high levels of something called inflammation. If you don't drink enough water, plain water, not coffee, that's dehydrating, not tea, that's dehydrating, but pure water with maybe a little bit of Celtic or Himalayan salt, pink salt, on a day-to-day basis. How much? We've said it many times. At least half of your body weight in ounces in water every day. And that doesn't mean sodas, that doesn't mean coffee, that doesn't mean tea. That means your body weight in water. So take a gut check. I ask patients, how much water do you drink? Oh, I drink a lot of water. Great. How much? Well, I drink a lot of water. No, I want to know in ounces, how many ounces of water do you drink every day? And then when you break it down that way, and the patient really gets a gut check and they realize that they're getting very little water, that's one of the processes. But let's get into the traumatic pattern, the dementia pattern that's associated with this neurodegeneration that can happen to the cells itself, and a decline in cognitive patterns and abilities that it can affect multiple levels of age. And it's not just confined to as we're getting older, because the signs of neurocognitive deterioration begins to happen early on. So we have to look at things like things that trigger excitatory reactions in the nervous system. What does that mean? That means the speed, if you will, from a signal coming down the nerve to the junction, the synapse, that's the junction, to the next neurological flow. If that slows down, all of a sudden you ask the question of a person that you're talking to, and you have that gap. It's like they can't respond as quickly as you want them to respond. Oxidative damage, that's due to stress patterns. If you're constantly under stress, you're always worried about something, you're increasing the inflammatory reactions and you're increasing oxidative damage. That's what it's called. So oxygen at high levels, unabated, will cause cellular deterioration. And there's things like we call cholinergic problems. And then oh my God, that tau and amyloid protein, which cause something called hyperphosphorylation. Now, as we get into it, and particularly on the 9th of October, I'm going to break these things down for you, and we're going to get into what they're really all about and how they affect you, but more importantly, what you can do about it now if you're starting to see signs of this. Now, let's correlate a couple other things. We know that viral patterns, remember what I just said, viruses, including flus and colds and herpes and other types of cytomegalovirus, Epstein-Barr virus at very high levels, they can cause problems as well. You've heard the terms that you've heard me talk about when it comes to heart plaquing, these apolipoproteins. Well, we know things that we look for in the vascular pattern called apolipoproteins, big A, small a, B, but there's also something called apolipoprotein big E, and that has to do with neurological tissue and the impact that we may be visualizing. So there's another piece called insulin resistance. Well, we've talked about that relative to diabetes, but how about insulin resistance when it comes to dementia? We have a new term now for dementia, and it's called insulin resistance type 2. And if that's the case, then all the garbage that we put in our system, the foods that we're getting that would cause a diabetic pattern, are also going to cause the brain to deteriorate and break down. Then we get into the storage of fat. They're called glycogen storage. And there's a whole pathway with that. And then there's this thing called the endocannabinoid system. And when you think about cannabinoid, you mean marijuana? Well, it's a cousin and it has a very significant impact. And it seems to be related to the pathology of that ugliness that we call Alzheimer's. So over the next few weeks, I want to really get into the pieces of the puzzle that relates to that. When we go into the live stream in a few minutes, and by the way, please join me. Go to drtomroselle.com, and I want to encourage you, please make sure that you follow me on all social media sites, because we'll let you know when we're sending out information. We'll try to give you little pieces of the puzzle on an ongoing basis. And if I'm going to do a special program, you'll know about it. You'll be one of the first to do it. Just go to drtomroselle.com. And particularly right now, right after the program, and there'll be a big banner that'll pop up, and just click it, and we'll continue this, and you'll be able to see this, this crazy face of mine. And, we'll talk about some of the other very important pieces of this dementia pattern, because we're going to kind of focus on that because of, its prevalence and continued prevalence. When we think about impact injury, and we're going to talk about that in the second part of the program today on the live stream. When we talk about impact injury, we seem to think it's confined to football players and as I mentioned to you before, soccer players, because they're smacking that ball around with their head all the time. But it can happen for so many other reasons. But what I want you to understand is dementia is caused by damage or loss of the nerve cells and their different connections within the brain. The symptoms depend on the area that's being damaged, sometimes shrinkage of the brain. And we're going to talk about why the brain shrinks, but also over time, what you can do to turn it around, both biochemically, neurofunctionally, with treatment, laser therapies, acupuncture, things that we know that work really, really well. So put the date aside, by the way, October the 9th. Matter of fact, why don't you just register for the class today and let us know, if something comes up that you can't make it, so we can prepare for you, so we have enough seating and we have enough information that we can give you when we decide to do those things. I think you're going to find it's going to be a really, really interesting evening. And, as always, it's going to be a tandem effect. We're going to go back and forth, and I'm going to make you listen to find out who that is. But enjoy your day in choices. And when I say enjoy your day, that's not hyperbole. Enjoy your day in decisions. Enjoy your day in choices. Enjoy your day in allowing stress to dissipate. And you'll find just doing those things, picking good foods, relaxing, listening to some good music, doing games that are non-stressful relative to, I have to do this but because I want to do this, I want to learn something, or I want to increase my cognitive design. Now, over the next few weeks, I'm going to give you all kinds of things to do that will be beneficial to you. Things that I think that maybe you haven't thought about before, and that you can add to your armamentarium. Things, little dietary pieces of the puzzle, maybe a couple things you really need to avoid. Trust me, after all the years I've been in practice, I've seen dementia come, and I've seen dementia in many cases reverse themselves. We're going to talk a little bit about MCT, or, medium chain triglycerides. All right. So when you hear that word, you have to know, why am I talking about it? Well, because it can reverse Alzheimer's, and it has to come from a very specific source, and it can't be just something that's adapted. When we talk about neurocognitive reintegration, what does that mean, and how can you do it? When we talk about the different components that are available to you, trust me, in this situation, being lied to again about things that are out there that actually do work. So pay attention. Join me right now on the live stream. We're going to get into it a little bit more. And I think you're going to have that aha moment that says, oh my God, this is really what it's all about. I promise you that aha moment can be quite significant. Remember, I'm here every Sunday. We do the radio program on WMAL 105.9, and then we go right into our live stream at Dr. Tom Roselle Live. It's Ageless Health live stream. Don't go away. Join me immediately. And remember, I do this for one reason only. I love you all. Join me right now.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.